everybody, Dr. Michael Nusbaum here from HealthTalks. As promised, we're going to talk about the different types of bariatric surgery, benefits, side effects, downsides to it. So let's get started. We have several different types. We have a gastric bypass, gastric sleeve, gastric band, biliopancreatic diversion or duodenal switch, and a gastric balloon. All right, so what are some of the benefits and side effects of the different ones? Well, gastric bypass, we're making a small pouch and cutting the intestine, creating a roux limb. So we're bypassing the stomach and some of the intestine. So benefits, significant weight loss. Once again, typically 20% of your excess body weight in the first month and then 10% each month afterwards. So the weight loss is pretty rapid. It does improve diabetes, especially type 2 diabetes. Not really type 1. I mean, type 1 is permanent, but it can help decrease your insulin requirements if you're type 1 diabetic. Also improves comorbidities, sleep apnea, high blood pressure, all weight-related conditions are going to get better with a gastric bypass. What are some of the downsides? Well, they are significant. First one is a leak. Obviously, that could either be a blood supply issue or a technical issue, but a leak can happen. It's usually early on. You can also get a gastric ulcer, a later condition, which can lead to perforation, and that's something that can happen usually in smokers. Nutritional deficiencies, well, once again, you're bypassing the stomach and the intestine, so you're going to get deficiencies of certain things that would normally get absorbed in those areas. So you're going to get some nutritional deficiencies. Dumping is when you have a high osmotic load, so too much sugar, too much fat, it's going to go right through you. So think of a coffee machine where you pour the water in, water comes right back out, it's going to go right through you. Infection, hernias, and bowel obstruction. Infections, usually short term, but also once again, if you have a perforation from a gastric ulcer, that can happen long term. Bowel obstructions, you're cutting the intestine, so you do have a risk of having a bowel obstruction for the rest of your life after a gastric bypass. That also exists with biliopancreatic diversion, duodenal switch. So you need to take that into account, that when you're having your intestines cut, you may need emergency surgery later on down the road, and it could be for the rest of your life. Hernias. The big one with hernias there are internal hernias. And it's kind of complicated, but basically the bowel kind of slides into an opening where the bowel was cut, and that could actually be life-threatening. And that exists for both bypass and biliopancreatic diversion and duodenal switch. So those are serious complications. Gastric sleeve. Significant weight loss. You also get improvement of the type 2 diabetes, and you do have improvement of comorbidities, high blood pressure, sleep apnea, and those are once again because you're losing the weight. Is the weight loss as rapid as a gastric bypass or as significant? No, but it's close. I'd say about 80%, with a lot less long-term and short-term complications compared to a gastric bypass. So gastric sleeve has kind of become the gold standard for bariatric surgery, and it's done more than any other bariatric surgery. Gastric band, this was actually my favorite when it came out. Unfortunately, what happened is I think the band company got a little greedy, went out and basically said to every general surgeon, hey, you could be a bariatric surgeon too, and we can teach you how to put gastric bands in. So what was happening is they were putting gastric bands into everybody. So a lot of patients who should never have gotten a gastric band got a gastric band. It really damaged the reputation of a gastric band. But I have patients who have gastric bands today, and they're still doing great. It was a really good operation. It was abused. Positives, less invasive, easily adjustable, and reversible. You just take the band out and you're back to normal again. Downsides, slippage, erosion, infection. Slippage is the gastric band can actually slide down out of position. The erosion is a gastric band actually eroding into the stomach, pretty rare, usually from ulcers or if they got an endoscopy and the endoscopist forgot to empty out the gastric band, the scope went in, cut the stomach along the edge where the band was and caused the band to erode. So that actually did happen. Infection, once again, usually related to erosion or a port site infection from somebody adjusting it but not doing it in a sterile way and introducing some bacteria. Biliopancreatic diversion, duodenal switch. These are probably the most aggressive of all these, with the highest risk of all of these. There is significant weight loss. There is significant improvement in diabetes and comorbidities, just like the others. But they are much more aggressive operations, and they do have higher complication rates compared to the others. Leakage, nutritional deficiencies, dumping, infection, hernias, bowel obstruction, mineral deficiencies, you're going to get all those. Once again, because these are the more aggressive of the operations. Gastric balloon, it is a temporary procedure. It's non-surgical, but it's at best 6 months. There are some gastric balloons that are out there that are looking for 12-month approval. But the problem is once the balloon comes out, you're going to put the weight back on. And that's what we see a lot. So short-term weight loss, a great procedure to have done. Long-term weight loss, not so much. And you need to keep that in mind. Downsides, nausea and vomiting, balloon deflation. There were some of the older balloons. I had one balloon that deflated, went right into the small bowel, had to do an operation, take it out. That wasn't fun. Ulcers, well, the balloon is a foreign body inside the stomach, so it's rubbing against the stomach, and it can cause some ulcers and pain. And once again, only 6 months, although some are looking for 12 months. And you're looking at a decent expense. It's not covered by insurance, it's out of pocket. And once you take the balloon out, the weight can come right back. So those are the different types of bariatric procedures. I would say gastric sleeve is the most popular. I used to love the gastric band, but it's not really done as much. Gastric balloon, okay, not the greatest, but it is available if you're looking for short-term weight loss. I would say after gastric sleeve would be gastric bypass, and my least favorite are BPD and duodenal switch, just because of long-term complications. Is a much bigger operation, higher risk. But those are the operations. If you have any questions, please reach out to me, let me know. This is Dr. Michael Nusbaum from Health Talks. Thanks a lot, and hope to see you guys soon.